Congressman Eric Cantor says the House will vote to repeal Obamacare on July the 11th. But there's no way the Senate will do the same. And even if it did, President Obama would just veto it anyway. So why bother? Republican Congresswoman Marsha Blackburn is in Nashville for us this July the 4th week. Congresswoman, what's the point? I mean, okay, so you'll vote to repeal it. Nothing will happen. What will you accomplish by this repeal vote?
You know, I think that sometimes things do happen, and we're going to stay at it until we get this bill off the books. You know, what the American people want to see, Stu, is for Congress to say Obamacare was a mistake. And this gives us the opportunity to start over with a clean slate and to do this right.
Now answer me this, if you can. I don't know whether you can answer the question or not, but look, Mitt Romney says he will keep the provision for pre-existing conditions. I mean, in other words, you've got a pre-existing condition, you cannot be denied insurance. I want to know who's going to pay for that, because that is wildly expensive. Who pays?
But, you know, there is a way to do this with risk pools and to place them at the state level and have them managed by the states. It would work more like a workers' comp situation. That's the way to go about it.
Okay. You think that would work? You think that would make that... You can keep this and manage the cost? You do?
Yes, I do. I think that you can look at some of the data that is out there, look at some of the pools that have been in place, and yes, that's the way to go about it. Dave Camp, who is chairman of Ways and Means, has done some great work on this. We have a plan to address that, just as we have a plan for how we would go about reforming health care. We've got lots of bills that have been in the works. We've got my legislation, which is a cross-state line purchase of health insurance. Get the cost down so that more people can afford to get in. Manage your risk through some of these risk pools. There's a way to do this in a more patient-centered way that's fair to taxpayers.
Would I be right in saying that the Republican idea for real replacement of Obamacare rests on a national marketplace, competition among insurance companies to offer me a low-price, high-quality health plan? It rests on private competition across state lines and also tort reform. Those are the twin pillars of a new form of health reform. Is that correct?
Well, and I would add one more to that that would make it a triangle. Let's have it patient-centered and allow the patient to make those decisions for what they want in a private marketplace and in a fair and competitive marketplace. And if you take those state lines down, increase that competition, allow the individual to be able to hire and fire their own doctor and to be competitive in that marketplace. Yeah, you're exactly right. Those are the pillars that are going to help to build this. That's what the American people want. They have not liked what the Obamacare policies put in place. They want to see us fight this. They do not like what is basically the Obamacare tax.
Can you get there? Can you have that kind of reform without, in other words, what I'm trying to say is, you've got to have Mitt Romney win, you've got to have the Senate go Republican, and you've got to keep Republicans in control of the House. You've got to have a sweep if you want to get what you're talking about accomplished.
Indeed we do. And the American people are going to stay with us. I think they're a part of this team. Look at how they have spoken out since the Supreme Court ruling, because so many people said, well, you know, in the summer of '09, everybody was saying this sounds like a tax. You know, it walks like a tax, talks like a tax. It's got to be a tax. And the White House kept saying, oh, no, 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 it's a penalty if you don't get this benefit. And people knew that that was instinctively wrong, and I think they're going to help us push across the repeal to get this off the books and to do health care right, that is focused on patients, increases choice and options, decreasing the cost. People want to see the Medicare restored. They want a simplified system.
I've got 10 or 15 seconds. How many Democrats do you think you'll win over to your side of the aisle on that July 11th vote?
I think you're going to see about 20.
Really? Okay. Well, we'll be watching for it, and we're very happy to have you with us this July the 4th week from Nashville, Tennessee. Thanks very much. Appreciate it.
Good to be with you. Thank you.